Antimicrobial resistance is a major public health concern that risks reversal of medical advancements in fighting infectious diseases.
How could this happen in this high-tech environment?
This necessitated a meeting between the Africa CDC, UKAID, among other organizations in Kenya, between the 15th and 17th of March to seek answers to the same.
Antimicrobial resistance is a problem because it affects patients. They can be more sick or they can have a higher risk of mortality. So that has a cost for the country. It has a cost for the patient.
Improper dumping of unused antibiotics either by consumers or retailers could also lead to antimicrobial resistance when absorbed by plants and consumed by animals and later consumed by humans.
The exposure through animals, especially animal protein, triggers resistance in humans because of the constant exposure of the same molecules in humans through food.
Poor data foundations in low and middle income countries and the lack of quality management systems could also mean that antimicrobial resistance rate in Kenya is higher than the indicated 56.2%. Kenya, for instance, had approximately 1,037 laboratories in the National Laboratory Network during the study period, out of which only 64 reported capacity for bacteriology testing.
If the data and the information is well collected, surveillance can teach you something. So where are the patients that are more likely to suffer from antimicrobial resistance? What kind of disease? Are those respiratory infections, sexually transmitted disease? Is it because they are bad practices in the hospital?
In every 100,000 deaths in Africa, 27 are attributed to antimicrobial resistance infections. The Africa CDC says in its study report that up to 34 uncategorized antibiotics were found to be in circulation.
We are working across various member states to strengthen laboratory capacity, AMR surveillance capacity, workforce, as well as infection prevention and control, and strengthening biosafety and biosecurity in agriculture as well as farms.
Kenya's Antimicrobial Resistance Coordinating Committee has to this end been tasked with developing facility-level antimicrobial stewardship programs to regulate the use of broader spectrum antibiotics and educate physicians on the importance of reserving these to maintain efficacy.
They were already playing that function.
Ben Kerera, K24, Nairobi.